What is good health? How can we achieve good health? How can we move towards a healthier future? Quite often when we think about health, we think about doctors, hospitals, and taking medication. We tend to think less about the things that affect our health. What are the key health issues facing Australians today? In 2011, 90% of all deaths were caused by a chronic illness. Chronic disease is Australia's biggest health challenge. Coronary heart disease is a leading cause of death in Australia for both males and females. The next most common cause of death for men is lung cancer and stroke. For women, it is stroke, dementia, and Alzheimer's disease. Indigenous Australians experience poorer health during their life and have worse health outcomes than other Australians. They have a burden of disease 2 to 3 times greater than the Australian general population and are more likely to die at a younger age, experience disability and report their health as fair or poor. Presenting a broad picture of the health status of Australians, to some extent, masks that there are clear inequalities in health for many Australians, particularly Indigenous Australians, people living in rural and remote areas, and the socio-economically disadvantaged. Let's compare the health outcomes of people living in regional and remote areas with those living in the major cities. Diabetes rates are higher in remote and very remote areas. Deaths from suicide are higher in remote and very remote areas. Death from perinatal and congenital conditions, as well as cirrhosis and other diseases of the liver, are ranked in the leading 15 causes in remote and very remote areas. In contrast, cerebrovascular deaths, dementia and Alzheimer's disease are higher in the city and in regional areas than in remote and very remote areas. Our health outcomes are clearly related to where we live, but our changing lifestyles are also impacting on us. For example, in the early 20th century, people ate fewer processed foods, walked more, did more manual labour, lived with fewer labour-saving appliances and gadgets, and spent less time in front of the television and other screens. Australians are becoming increasingly inactive. In 2011-2012, only 43% of adults met the National Physical Activity Guidelines of at least 30 minutes of moderate physical activity on most days. In 2014, 63% of Australian adults were overweight or obese. This percentage is compared with 61% in 2007-8 and 56% in 1995. Other lifestyle issues such as not eating enough fruit and vegetables and smoking and drinking alcohol at risky levels are also impacting on our health outcomes. All of these behaviours put people at risk of developing chronic diseases. Consider the relationships between the behaviours illustrated in this table and the associated chronic health conditions. How do these behaviours relate to the conditions into which people are born, grow, live, work and age? These are the social determinants of health: income, education, employment, early childhood development, access to food, housing which includes the community in which you live, access to transportation, social support networks, gender, disability, the cultural groups to which you belong. Let's have a look at how the social determinants of health interact. Social stresses I face, lifestyle decisions I make, housing and food I can afford, the community connectedness I experience, the income I earn, the occupation I hold, the education I have, big public policy choices, social policies, housing policies, our community policy choices, economic policies, labour policies. The World Health Organisation's Commissions on Social Determinants of Health concluded that social inequities in health arise because of inequalities in conditions of daily life and the fundamental drivers that give rise to them, inequalities in power, money and resources. So let's meet Susie. She's in the hospital emergency department again. Why? She's had an asthma attack because she has started smoking again. Why? Susie is stressed because she is living in a one-bedroom flat with her 3 children. She was employed as a process worker in a local factory, but she was laid off when the company was bought out. Since then, she has had to move her family to somewhere smaller because she could no longer afford the rent on her pension. Why can't she get a new job? Susie lives in a regional area where there is a lack of jobs for people with her skills, and she does not have the education to do anything else. What does Susie need for her health? Coping skills, the ability to make healthy decisions, affordable, healthy food and housing, education, so that she can secure a good, well-paid job, money for housing, food and clothing, a safe community with friends and family, knowledge about healthy lifestyles. So if you think about all of the social determinants of health that are influencing Susie's life, if Susie can be supported to make small steps to improve her social determinants of health, think about the benefits that will flow through to her children. From small individual steps to bigger governmental policies, we can start to make the connections to a healthier community, a healthier society, a healthier you.